Thank you all for coming. I'm joined today by Dr. Kerry Chan, our Chief Health Officer, the Health Minister, Brad Hazzard, our Treasurer, Matthew Kean, and also today Dr. Lucy Morgan, who's a respiratory specialist at Concord and Nepean Hospital, who'll speak about the clinicians' experience each and every day during the pandemic and some of the challenges and the pressures that they're under as we move through this Omicron wave. And also Julia Robinson from the Australian Festivals Association. Can I begin today by once again acknowledging the fantastic work of all of our frontline health officers right around the state of New South Wales. Our nurses, our doctors, all our O operators, our paramedics, who each and every day over the past 2 years have continued to look after people right across New South Wales to ensure that those are sick are cared for as we move through this pandemic. They are an inspiration, and on behalf of everybody across New South Wales, can I thank them for everything they do day in, day out to protect our people during this pandemic. Can I also thank everybody across our state for the sacrifices and the efforts that have been made during this testing time. It has been a testing 2 years. It is 2 years that has tested our resilience as a people, but we have continued to make the efforts and sacrifices that have kept our state strong, that have kept people safe, and have in the main kept society open. It is a difficult time, not just here in New South Wales and around the country, but around the world. But the efforts that people have made have ensured that we've been able to move through this pandemic in a very strong way. And whilst I accept and appreciate that people across New South Wales and across our country are anxious and nervous at this difficult time, if we look at the past and we look at the efforts that we've made and the strength that we've had coming through this pandemic, I know that we will be able to push through this next wave as well. The best way through this pandemic is to push through. And what we can't have, and I understand it's different approach to the last 2 years, but what we can't have here in New South Wales and across the country are never-ending lockdowns, because that will result in a pandemic that becomes a never-ending story. And the strength and the resilience and the investments that we've made here in our state, in our health system, whilst it is under pressure at this time, we have the best frontline health workers anywhere in the country and anywhere in the world who are working tirelessly day in, day out to keep people safe. And that strength and that resilience will ensure that we come through this next period of time as well. But also note that the key to that, we talk about the efforts and sacrifices that people have made, the sacrifices over the last couple of years, when many people who have not been able to celebrate their weddings, many people who have not been able to say goodbye to their loved ones. But the strength here in our state has been the enormous efforts that people have made to go out and get vaccinated and receive that booster shot. It is very, very clear that vaccinations and boosters are key to keeping people safe, our friends and our families safe. If we look at the numbers today, 200 people in ICU, 50% of those people in ICU are unvaccinated. The evidence is clear, and that's why I continue to ask people right across our state, if you haven't received that booster shot, please go out and do it. It's pleasing to see that 47% of people who are eligible for a booster shot have gone out and received it. That can occur in one of our 40 clinics across New South Wales, also through your GP and your pharmacist. As we head through January, more people will be eligible for a booster shot. Currently, it's 4 months since your second dose vaccination that you're eligible for that booster shot. So please, please plan ahead. I want to thank everybody for the efforts they've made, particularly over the Christmas, New Year's period, when many people are on holidays. They've found the time to go out and receive that booster shot. It's clear from those figures in ICU, which Minister Hazzard will also speak to today, that boosters and vaccination are key to keeping you and your family safe. And that's what sets New South Wales apart from anywhere in the world, and Australia apart from anywhere in the world, and as to why our response has been so strong in the face of this ongoing pandemic. Having one of the highest vaccination rates in the world has meant that we've been able to have one of the lowest death rates whilst at the same time keeping society and the economy open. And it's incredibly important as we move through this next phase. So boosters are key. I ask as we move through January, from this week, we will now have capacity in our own clinics to administer around 270,000 vaccinations each week, just in our centres alone. But as we've said in the past, you can also get that shot at your pharmacist or at your GP. And even if you've received your vaccination at a GP or alternatively in one of our clinics, 40 clinics across the state, you can still receive that booster shot in any one of those three. So please, if we continue that sustained effort, that will ensure that we continue to keep people safe during this period of time. I'm going to say that those efforts and those sacrifices have ensured our strong response here in New South Wales, and those sacrifices that people have made. And so my ask today is if we can continue to make those efforts, continue to treat people with kindness and respect. Those are the values that have ensured that New South Wales has stood tall, has stood strong, and will ensure that we get back to the life that we love as quickly as possible. Those are the values that have united our people during this period of time. It's the efforts that everybody has made, those sacrifices that people have made, that has kept New South Wales strong during this period. I once again want to thank our frontline health workers for the continued effort. It has been a tough 2 years. It's been a difficult 2 months, but we will push through this period of time. We will come out stronger the other side, and that is on the back of the efforts and sacrifices that people right across New South Wales continue to make. Now, Minister Kean will also talk today about an event saver program due to events and festivals that have not been able to proceed due to public health orders. So he will make some comments in relation to that plan. The support that we've provided in the past, over the last 2 years, will continue to be provided during this next wave. We've always said that we put people before the budget. That has been the success of our approach here in New South Wales. We want to make sure, as a key tenet here, that we keep people safe, we keep society open, and we keep people in work so they can provide for their families. That's been a success in the past. We've got through those challenges, and we'll get through the next challenge that comes our way as well. I'm now going to pass to Dr. Kerry Chan, who will give a public health update. Then Dr. Morgan will speak from her perspective in relation to respiratory care across the hospital system here in New South Wales, but particularly talk about her personal experience. And then Minister Hazzard will speak about, once again, the importance of boosters and the vaccination program here in our state. And then Treasurer Kean will speak about the new Event Saver program.
So across New South Wales, we continue to see that vaccination coverage rate increase. We've got 95.2% of people aged 16 and over have received their first dose of the COVID vaccine. 93.8% have received 2 doses. The 12 to 15-year-olds are 82.1%. So we've seen that first dose come up, and the second dose is now at 78.3% have received the 2 doses. And of the 5 to 11-year-olds, we've got 13.1% have received their first dose of the COVID vaccine. And that's really quite amazing, given we've just opened that program. In terms of COVID cases admitted to hospital, we have 2,776 COVID cases admitted to hospital, including 203 people in intensive care, 61 of whom require ventilation. There were 29,504 positive test results notified to 8 p.m. last night, including 11,858 positive rapid antigen tests and 17,646 PCR tests. So of the 11,858 positive RAT tests, 10,187 of these were from the previous 7 days. And they're also, just to alert you to that, maybe some duplication between the PCR test and the RAT test, and we are working to deduplicate what we can. And of the 17,646 positive PCR tests, they were returned from 85,767 PCR tests. Today we are reporting the deaths of 17 people with COVID, 12 men and 5 women. and can I just pass on my condolences to their families for their loss. One person was aged in their 60s, 4 people aged in their 70s, 9 people were aged in their 80s, and 3 in their 90s. Can I just re-emphasise that you're particularly at risk of severe disease from COVID if you're over 65 or have underlying chronic conditions impacting the lung, hearts, kidneys, liver, if you have diabetes, or if you have conditions that impact your immune system, what we call immunocompromised. You are at risk of severe disease, and I can't urge you more strongly. Please come forward and get your booster. Only 1 of the 17 people that died had been boosted. We know that for the Omicron variant, having that booster is critical to upping your level of protection. And we know that with both variants, even though the Omicron variant is milder overall, it still will have an incredible impact on people that are elderly and those underlying conditions. So the best thing you can do is get vaccinated. The other message is we have bookings available in a number of our health hubs, and so if you are finding it difficult to get into your GP or your pharmacist, please go online and find a booking. The saddest thing for me will be if there are any bookings that are left unfilled, so please take up every opportunity you can to get vaccinated. Thought I might also give an update on Omicron versus Delta and what we think the transmission of the relative strain variants is in the community. So data from the 16th of January, and I just want to acknowledge the private pathology provider who's been sharing sequential data. As I've indicated before, this is based on the fact that the machines that provider uses detects the S gene dropout, which is characteristic of Omicron, shows that over 95% of samples taken over the recent 2 days are of the Omicron variant. I would also say that I'm aware of the social media rumours and misinformation on the website, particularly targeting parents of children, but also pregnant women, and also our Aboriginal communities. Can I just urge everyone to go to a trusted source of information? Don't read or engage in those social media posts. Talk to your GP, your pharmacist, or go online and look at the government websites. For parents, the National Centre for Immunisation Research has got a lot of information about COVID, its impact on children, and also the vaccine. So please use those trusted sources and do not engage in some of the misinformation that is just incredibly dangerous. Given the broader community transmission of COVID, I would like to flag that the number of deaths are likely to be high over coming days, but the key message is those boosters will improve the protection. It does take 7 to 14 days after the boosters to afford that protection, so I can't stress the urgency for taking up every booking available and get your boosters now.
Thank you. Hi, my name's Lucy Morgan. I'm a lung specialist, I'm a lung doctor, and I work as part of the team of people looking after patients with COVID at Nepean Hospitals and Concord Hospital. Please excuse my notes, I'm a bit nervous speaking in front of you, and I'm really very tired. I was in the hospital till about 1 o'clock this morning, and about every hour between 1 a.m. and 6 a.m. I got another call about another patient sick enough to be admitted to my hospital with COVID illness. So I am a bit tired and I'm a bit nervous. I've been a lung specialist for 25 years and I've got a lot of experience now with looking after patients with COVID. I've been working in this pandemic for 2 years. So I feel well placed to talk to you about the real clinical impact on people when they get COVID illness. I'd like to share some of these experiences with working in these teams and to help us all to understand better why things are so hard for us working in the hospitals when Omicron is supposed to be a milder infection. And I'd like to explain why boosters play such a critical role, I think, in helping to keep our hospitals going. So boosters, hand hygiene, sensible physical distancing and social connectedness all being part of our strategy really long term for managing COVID in our community. And after I've spoken, I'd be really happy to take questions related to hospitals and patients and frontline workers. Look, New South Wales hospital staff have got 2 years of experience with managing the challenges of COVID-19. We've got really remarkably sophisticated treatments for COVID-19 now. We've got extraordinary vaccine programs, and we've got one of the most vaccinated populations in the world. But we are exhausted. And in responding to the unprecedented demands, the thousands of patients presenting to our hospitals every day, our capacity to manage everything else has also really changed. In the short term, you know, that's okay. But in the long term, and it's 2 years now, this is bad. It's really hard on us, and it's really hard on the people of New South Wales because this is leading to some delayed diagnoses, some longer waiting times for everything, and a huge burden on our community as we try to keep everything ticking over. This is why every little thing that we can do to reduce the incidence of severe disease from COVID makes just such a difference. When I last spoke to this audience, I think we were in the thick of the Delta wave. The community was not vaccinated in really high rates. People were getting very, very sick with very bad lung problems. We were getting COVID pneumonitis, so lung failure because of COVID infection with Delta. And we were really worried about not having enough intensive care beds, not having enough ventilators to look after this wave of patients with severe lung failure. But the system really responded. We learnt more about the disease, we adjusted, we used all those words like agile and adaptive, and we changed the way we treated patients. We bought lots of equipment, we trained ourselves up, and we changed the way that we managed these patients so that we could look after people who needed intensive or lots of respiratory care, even when there wasn't enough room within the intensive care unit. And this made an enormous difference to the people of New South Wales. We saved lots of lives. And at that time, our vaccination rates started to rise. Thank you. That was the most important thing we could do for each other at that time. And we as a community were protected from the severe illness that COVID, the Delta variant, caused, and the wave passed briefly. And then came Omicron, so similar in so many ways to Delta, a flu-like illness with some minor subtle differences in the way that it causes symptoms for patients. So lots of aches and pains, lots of headache, lots of very sore throat. And for some people, still severe illness. So having Omicron does not mean you're just going to have a cold. Omicron, as a variant of the COVID-19 virus, has the potential to cause very severe illness, just like Delta. And those at particular risk of getting very sick from Omicron are the same group who were at risk from Delta. Those who are incompletely vaccinated, those with underlying health complaints or conditions, and those who are frail, and that includes our elderly community. It is true that most people who catch Omicron do not get so sick as to need my care or the care of my colleagues in the intensive care unit. Proportionally, most people do not get as sick, but it is so much more contagious than the Delta variant. The sheer number of people who get COVID is enormous in comparison. So even if 9 out of 10 patients with Delta have symptoms that leave them feeling crook, but they can recover at home, there are still thousands of people every day who are sick enough to present to hospital. Now, most are discharged from hospital. They're assessed by clinicians in the emergency department or in the virtual hospitals, and they're discharged back to their own homes. But even so, thousands are admitted across the state every day. I think in the last 24 hours, and I've been on call for those 24 hours, there were more than 2,500 patients admitted to hospital. So why are we so full? Why are the hospitals so full, and why are we so stretched if Omicron is supposed to cause less severe disease? Well, there's 4 key things I'd like to mention to you. One is that there are still people who are incompletely vaccinated. So those people are, some of whom have not had any vaccinations at all, some of whom are yet to get through their 3 doses, as Dr. Chant mentioned, the 2 doses and then the booster. And there are a small group of patients who, despite having all their jabs, they do not have an immune response that's complete and able to render them able to fight the virus. So there are still, if we think about 8 million people in the state, even if there's 1% unvaccinated, that's 80,000 people who are still at significant risk of catching COVID and developing severe disease. Many of these are our community's most vulnerable, our homeless, our patients with very severe or uncontrolled poor mental health, those living in disability support facilities, even aged care facilities, our frail elderly, and our comorbid. That's a funny word, but it means people who've got lots of medical things wrong with them. Okay, there are some people whose immunity has waned over the last 2 years, and this is a particularly important point about getting boosters. So those who were vaccinated in the first waves of vaccination, which includes our healthcare workers and our elderly patients, are now coming to the time when they need boosters and their immunity is waning. And then there's our hospital staff, who are, of course, a part of our community, living at home with their families, and who are now catching COVID themselves. If they're not ill with COVID, they're caring for their family members that have become close contact. These are not staff who caught COVID at work. Our PPE works, and we know how to use it really, really well. But these are people who are living in their families and therefore catching COVID in their family units and therefore can't come to work. Okay, these are the people that keep our hospitals running. Yes, it's doctors, yes, it's nurses, but it's cleaners, it's porters, it's people who help to feed patients, to wash patients, to clean the wards, and to get food to patients. And we have, and those who are left standing are carrying a much higher burden because we've got so much of a gap in our workforce at the moment. I think yesterday there were 6,000 staff members in the state unable to work. Look, last night I was in the hospital at 1 a.m. The senior nurse helping me look after patients in the COVID ward was the same nurse at 1 a.m. who'd been there at 7 a.m. when we'd handed over. She'd been there all day, double shift. The hospital is full of stories like that. So we're doing the best we can. We're going to keep doing the best we can. I'm getting the roll up, and I just want to make sure I've made one final point. The last time I spoke to this forum, I encouraged us all to get vaccinated. It's still the main message. Boosters in combination with washing our hands and physical distancing remains a very, very important part of our fight against COVID and about keeping our hospitals running. Omicron is still a potentially very severe virus, and if we're going to keep going, we really, really need to do everything we can as individuals to keep our hospitals ticking over. Thanks very much. I'm happy to take some questions. Oh, okay. Sorry.
I'd like to start by thanking Dr. Lucy Morgan and all the doctors, nurses, allied health, cleaners, porters, administrative staff who she just talked about, who are utterly exhausted after 2 years of this pandemic. I think it's important that we as a community recognise and understand the pressures that our medical community are under, not just those in the hospitals, of course. General practitioners, pharmacists are also part of that equation. Dr. Morgan has been, as she referred to herself, a lung specialist or respiratory specialist for 25 years, but she is now a 2-year COVID veteran. It is almost 2 years since we had our first 4 cases, 1 week and 1 day away from the first day we had COVID arrive on our shores. And in that time, those doctors, nurses and all the other health staff right across our community have reached the stage of exhaustion. I want to just say to the community, it is time for all of us, if we haven't been vaccinated, to go and get vaccinated. The latest data from New South Wales Health shows that in this Omicron wave, if you are not fully vaccinated, you are 6 times more likely to end up in hospital and 13 times more likely to end up in ICU. 6 times more likely to end up in hospital and 13 times more likely to end up in ICU. That means you are requiring the assistance of the health staff who are already exhausted. Can I just say to those people who have chosen not to get vaccinated, it's time to give a damn about someone other than yourself. Give a damn about your community, your family, and most particularly the health staff across New South Wales who you expect to be looking after you if and when you end up in our hospital system. Thank you.
Could I firstly begin by passing on my sincerest condolences to the families and friends that have lost loved ones during this very difficult time. It is a very difficult time for everyone across New South Wales, but particularly if you have lost a loved one. Could I also pass on my best wishes to everyone that's currently ill with COVID, whether it be at home or at hospital. We're thinking of you at this time. Could I also take this opportunity to thank sincerely the incredible people working in our health system that have worked so hard over Christmas and the New Year period to keep us safe and to get us through. They are absolutely incredible. They've been doing this for 2 years, carrying our community. It's not just our health workers though. I want to express my appreciation for all those people that have kept our economy going. People in our logistics chains, people working in childcare. There are so many that we have to thank for keeping us safe and keeping us going through this very difficult time. My message to the community is that there is light at the end of the tunnel. We've seen from international experience and based on the modelling that New South Wales Health have provided us that over the next 4 to 6 weeks there will be a significant decrease in cases across the community. So whilst this is first and foremost a health crisis, there is also significant economic impacts being felt. That's why today we're here to announce support for one section of the economy. That's the events and festivals section. Events and festivals play a really important role in growing our economy, employing people, and also supporting tourists and other industries across the state. They're doing it particularly tough at this time, and that's why we're announcing a support package for those festivals that have been impacted by changes in public health orders. Festivals that have been impacted and festivals that might be impacted in the future. This fund is a $43 million fund that will ensure that we will underwrite sunk costs for those festivals that could be impacted by changes to public health orders. In the coming days, we will also be talking about other measures to support other businesses in other sections of the economy. What we want to do is to preserve the economic fabric of the economy, or the fabric of the economy, ensure that we come through this not only safely, but we come out stronger. So my message to the community is very clear. We will stand with businesses, with families, and with workers in New South Wales to make sure we come through this safely, but also come out on the other side stronger. And we'll be having more to say about support measures for other businesses and other sections of the economy in the coming days. I'll now hand over to Julia Robertson from Festivals Australia to say a few words.
Thank you, Minister. Well, today we would just like to welcome the Event Saver package for the from the Australian Festival Association. We have been doing it tough over the last 2 years, as everyone has, but this package is really great for building confidence, for helping those festivals that have got events that are coming up to maintain those festival lineups, but also to those events that have had to be cancelled over the last couple of weeks due to the Omicron variant. We will be able to help those events recover some of those costs that they've lost, which will go a really long way to building that confidence for the festival industry. So thank you.
Premier, the entire way along we have been doing all of this, restrictions, lockdowns, economic pain, to stop people from dying. We are now seeing around 20 deaths a day. Is that too many, and should more be done on a restrictions level to stop this spread?
The only alternative is to go into lockdown. We have a highly vaccinated population. The efforts that people have made right across the state to get vaccinated, to get that booster shot, is the best thing that we can do to keep ourselves, our friends and our families safe. Right around the world, we're seeing countries dealing with the pandemic. We have to deal with the world as it is, not as we want it to be. As we've said in the past, in terms of the previous federal roadmap, we're working towards a vaccination program of around 70%. To be at 95% means that we can open up society, which is exactly what we've been doing. We've invested record amounts in our health system. That every health system, as you heard from Dr. Morgan, right around the country, right around the world, is under substantial pressure. We're doing everything we can to keep people safe. Now, obviously, as we move through this next phase, when the concept which we've talked about for the last 2 years, living alongside the virus, is a challenge. It is difficult, and when you're in those situations, there will no doubt be more hospitalisations and ICUs, as we saw during the Delta outbreak. But ultimately, the best thing that we can do is get vaccinated, receive that booster shot, and by doing that, we will ensure that we push through this next difficult period of time.
So Premier, are you saying that there's nothing between the restrictions, the minimal restrictions are in place now, and a lockdown? There's no movement.
What we are seeing with Omicron very clearly is a less severe disease, but one that is highly transmissible. Case numbers will increase. Now, what's pleasing and encouraging today and over this period of time is that we are seeing case numbers not escalating at the rates they were. But we're seeing that escalation of case numbers right around the country in every jurisdiction. New South Wales is not an island. We all have to continue to make the efforts that are in place. The restrictions that we have in respect of isolation for 7 days is making a substantial difference. And ultimately, above all of that, what we have to do is continue that booster shot campaign. That booster shot program will ensure, whether it's this variant or other variants that come our way as we move through this pandemic, that we live alongside the virus as best we can. That does not mean there will not be challenges. We've seen that over the last 2 years. We've seen people lose their loved ones. We've seen people not being able to say goodbye to their loved ones or not celebrate important milestones in their life. These are the efforts and sacrifices that we have made over the last 2 years. And there will be difficulties that come our way. Sending children back to school, for many parents, many are anxious about doing that. But it's incredibly important, as we are living alongside the virus, that kids are back in school and being educated, not just for their own educational outcomes and their opportunities in life, but also for their mental health. Also, for a whole range of other factors, we need to ensure that as much as possible, we are living alongside the virus. That is not without its issues. That is not without challenges and difficulties that will come our way as we move through. But our number one priority as a government is to keep people safe and is to keep society open so that men and women right across New South Wales are able to go to work, provide for their families. And every decision that this government makes, every decision that we've made over the last 2 years weighs incredibly heavily on us. But ultimately, it's about finding that balance and making sure that as we move through a period of time with a highly vaccinated population, that we push through. And
there's not a lot of confidence in that strategy. There's a survey out today from Business New South Wales that confidence from businesses is an all-time low. And there's a shadow lockdown happening. So what are you going to do to boost that confidence? Because confidence is at all-time low in these decisions.
But we also saw today a report from Deloitte Access Economics that spoke very much about the economic rise that will occur as we move through this period. This is a transitionary phase that we are moving through, and that creates its own challenges. It naturally does. But we have to face into it, the best way out of this pandemic is to continue to stand strong and push through. That is the approach that we're taking right around the country. And it's not the easy approach, but it's the right approach. And sometimes that will bring with it challenges, difficulties, for many people right across the state, as we've seen over the last 2 years. But it's the hard road, but the right road. Our number one focus is to continue to keep people safe and confidence, just like the last 2 years. As the former Treasurer, every time we went into lockdown, confidence fell and then rose again. And that's what we will see again. That's what the report clearly shows today. That's the global experience as well with the pandemic. But we have much more to be confident about, because our vaccination rates, unlike anywhere else in the world, will ensure that we continue to keep people safe as best we can during a global pandemic. And when you do have escalating case numbers, when there are disruptions to supply chains, when there are queues for PCR tests, that creates inconvenience. That requires sustained patience and a continued effort, the continued effort that we've seen over the last 2 years. That will continue to get us through. That means at times, as we're seeing now, confidence will fall, as it has over the last two years. But the experience is clear. Confidence will rebound as we push through.
But Premier, it's more than an inconvenience. Dr. Morgan has just said that the sheer volume of case numbers is leading to an overwhelmed system. So are the current settings enough to curb the spread to the point where the hospital systems have closed?
Well, that's why we've been incredibly
Because Dr. Morgan is saying it's overwhelmed at the moment.
We face the same challenges. We face the same challenges during the Delta outbreak. And that's why 2 weeks ago we released the modelling, which shows on 3 separate scenarios where the health system is at. There is no doubt here or around the world there is substantial pressure on the health system. Every Friday we will continue to release where we are tracking against that modelling, and where we sit today we are tracking better than the best case scenario we put out. Now, as part of that, we have made some changes in the deferring of non-urgent elective surgery, just as we've done in the last 2 outbreaks before, and just like other states around the country are also pursuing. Now, that obviously provides hardship for many people who are waiting for that non-urgent elective surgery, but it's the right approach to minimise pressure on the health system. That's the approach that we're taking in every state around the country as we move through this next wave. There's no doubt that following the last 2 years and today, there is substantial pressure on our health system. But we will push through this despite those challenges. We've overcome them over the last 2 years. There is light at the end of the tunnel. And we are going to get there because of the efforts and sacrifices that people have made and the wonderful and inspirational efforts day in, day out by our frontline health staff.
But Premier, where we're not tracking data is the number of healthcare staff who are now in isolation or who have COVID. This is simply because we are not in a lockdown. They are exposed at work and at home.
Yeah. And that is not a unique challenge to New South Wales. That is a challenge that we are facing right around the country and right around the world. But whilst it does add pressure to the system, the isolation requirements that we have in place are incredibly important because it ensures a slower spread of the virus as we move through what is a highly transmissible variant, but one that overall is less severe. Now, as Dr. Morgan has said, that puts substantive pressure on the health system, just like it did during Delta. But I'm incredibly confident, if you look at the modelling, if you look at the investments that we have made, that we will stand strong and pull through. It will be difficult. It is difficult. It's been a difficult 2 years. But we will get through this and come out stronger the other side. The health system continues to support those people who need that care, who need that love and support, and we are providing that despite the pressures, as Dr. Morgan has outlined, that we are under. And in addition to that, we will continue our focus of making sure we keep people in work during the pandemic, not for the sake of it, but so that they can continue to provide for their families, as we've seen over the last 2 years with record high unemployment. That provides other challenges and issues for families right across the state. So as we work through, we'll continue to make the changes that are necessary, but we will come through this just like other states around the country, we will come through this, and as a people, through the efforts and sacrifices, through that vaccination rate and that booster campaign that we are running, we will come through. And the evidence is very clear, as the doctors have spoken about, as the minister has spoken about. That booster shot is crucial in keeping you safe as we move through.
40% of Australians at the moment that do not have enough money to last more than 3 months. When will they get the economic support that they're
Sorry, say that again.
40% of businesses say they don't have enough money to last them longer than 3 months. When will they get the economic support?
Obviously, we've announced our first support package today through the Treasurer, and as he's outlined, he's working through a range of packages. And as the former Treasurer of this state, I know very well that you look at the evidence that's in front of you and you tailor the packages to make sure where you invest with impact. And I'm incredibly confident that the Treasurer will provide that support package as we have in the past. And we've always said over the last 2 years during this pandemic that we will put the people of our state ahead of the budget, where that's investing record amounts in our health system. From the outset, I said to Minister Hazzard, as former Treasurer, whatever you need to invest in the health system to keep people safe, we will provide. That's exactly what we've done, and we've taken the same approach on economic support. So as we move through this next phase, the Treasurer will continue to announce those support packages tailored very closely to where that need is.
Will that package include an extension of the isolation exemptions to hospitality workers for asymptomatic post-contract hospitality workers?
Well, obviously, as we move through those isolation exemptions, and we're clearly focused on critical workers, because ultimately we want to make sure we keep people safe. Now, I understand the concerns of the hospitality industry in relation to pressure on labour, but at the same time, we need to make sure that there's two aspects to that: that people who are going to work in what would appear to be more of a high-risk environment in the hospitality setting is something that the government and the health teams are focused on, because that's very different to working in a distribution network or in the freight industry. And in addition to that, we also want to instill confidence in people going out to restaurants, going out to cafes, and we don't want to compromise that through making that change. So it's not as a simple issue as, well, with the hospitality industry, make that change and that issue will be resolved. But there are issues within the hospitality space the Treasurer is working on, and once that package is been finalised and settled by the Expenditure Review Committee, we will announce it.
Last one, please. Can I ask a question, please?
Thank you, Dr. Morgan. So in earlier press conferences, we have heard that they're bringing in students, seeking upskilled physiotherapists to help out. As someone who is on the front line until 1 a.m. in the morning dealing with this, how is that impacting the standard of care in hospital?
Everybody that we can rally to come and work and help us to provide care in the hospitals is an asset. I think one of the most important things that I can do, and people, and we've got a large group of senior experienced COVID clinicians in the state, can do, is to help to think outside the box about ways of staffing our hospital and providing care to patients from people who have not previously delivered that care. That might be about bringing in people who've been working in administrative roles into some care roles in the hospital, bringing nurses who've been working in education and training roles back into clinical workforce, bringing in our new grads when it comes to students, whether they're medical students, physio students, or nursing students, and we're about to see a graduating year of new young doctors coming in. But it might also be about thinking way outside the box about other ways of delivering care. It's not about replacing nurses and doctors, but about expanding the pool of people that we have to help us care for patients in hospitals.
Last one, please. Last one.
You reported video interviews with patients at Concord, and some of them expressed regret about not having been vaccinated. With the patients we're seeing now who've not been boosted, why is that? Are they not eligible? Were they not able to receive the content? Did they not know that that was a step they needed to take?
Widely my experience has been that there is not people are not intentionally not getting their booster. It's just a matter of timing. Omicron is very infectious. It moves like wildfire, and most people just catch Omicron before they've been able to get their booster shot.
Thank you all. Sorry.
Very fast on the issue of anti-vaxxers and children. There's a lot of misinformation going around on the internet about children dying. There are claims that children are dying. What is your response?
The anti-vaxxers are absolutely irresponsible in the messages they're giving about children. Children are best served by getting them vaccinated. In fact, the broader community are best served by getting them vaccinated. Today, we are here at the Royal North Shore Hospital, one of our amazing hospitals here in New South Wales. A few hundred metres from behind me is the intensive care unit. There are 12 people in there today with COVID, and 7 of those people are completely unvaccinated. How much clearer can it get? The short message to any of these anti-vaxxers is just go away somewhere and stop spreading lies and mistruths. What you're doing is you're scaring people unnecessarily. Live in your own world. I mean, unfortunately, social media allows people to gather together and they think that they're actually the majority. They're not. But they can actually send messages which are absolutely wrong, spurious, misleading, and actually, quite simply, could cause someone's death. So give a damn about someone else other than yourself. Thank you very much, everybody. Thank you. Welcome back.